Let's turn now to the payer side of the equation to learn more about how they and their members have been impacted over the last 20 months. Joining us remotely is Erhardt Preitauer. He's the president and CEO of CareSource, a nonprofit multi-state administrator of Medicare and Medicaid managed care plans in Ohio, Indiana, Georgia, Kentucky, and West Virginia. Erhardt, welcome.
Well, thank you. It's very nice to be here in front of such an esteemed crowd, or I guess in a virtual world, maybe we'll call it a group. I'm also grateful for the opportunity to speak about something that's very important to myself and to our organization. And so the topic of the day is right down our alley. So CareSource, nonprofit, our focus as a payer, the way we sort of come at this is perhaps just a little bit different. And we sit in the ecosystem in a unique way where we have a lot of data. We see everything that happens to our members. We are in the communities, we collect data from the communities, and we then try to use that. We also have a lot of partnerships. And for those that are here today that partner with CareSource, I'd like to extend a special thank you for your partnership. And we look to continue to do that. One of the things that I thought I might talk today a little bit about is just to give a few specific examples in a COVID world or a post-COVID world of how we're using that data, sort of how we're approaching health equity, disparities, and all the elements that are going along with that. And so certainly, no one organization can fix the challenges, right? We've got a partner to be able to move forward. And so I do want to recognize the amazing work that's going on in the great state of Indiana, in the social world of the community-based organizations and the different providers. But here's one view. As we think about the systems of care, as we think about the different social construct structures, supports out there, COVID exacerbated any of the problems that existed. On top of that, we know that COVID disproportionately impacted minorities. And so we've all seen the data, we sort of get that. And so as we come out on this back end, we think that the role that we're playing, the view that we have becomes, and the ability to partner with folks like yourselves becomes even more important. And so here's a couple of examples. One of the things that CareSource has is this life services program. So we talked about social determinants, but we've got people on the ground with the ability to look at data, to get referral sources, and to be able to partner with community resources. In some respects, we actually partner with the community resources to figure out how to go get money and how to go get grants, which empowers the communities. And our ability to be in the community, listening and understanding which of those organizations we can help to empower is something that helps everyone. Our life services programs also, sort of help people to sort of move forward. And again, in sort of this COVID environment, we see all of the challenges exacerbated. And so we were proud, actually. There was a third-party organization that came in and did a study about what the impact of our life services program was in Indiana. And we think about all the medical costs that's associated with someone that doesn't get the right care because of a social determinant issue, or we think about the positive economic impact of getting someone the ability to go get a job. This study showed something like over $80 million a year in sort of additional sort of benefit through this program. But more important than that are the lives that we're able to touch and the lives that we're able to sort of help move forward. So we're very proud of that. And we've taken that sort of expertise, and we've actually partnered with the Indiana Department of Corrections in a similar program where, as we know that people coming out of or that are justice involved are coming into a system now that has been strained by COVID, that is even more fragmented, And so the ability to sort of engage someone coming out of a facility becomes even more important today than it ever was. And so the ability to engage before they sort of leave. And by the way, I think we work with members that may not even be CareSource members. But again, as a nonprofit, we're here to sort of help the community and think about the broader good of Indiana. And so, and the data on our ability to engage someone before they come out of a facility, a justice facility, in terms of follow-ups and in terms of the abilities to sort of get them. I mean, think about coming out of a facility. You may not even have a license. Well, how do you get everything moving forward if you don't have a license? And the simple things like that can be massive barriers that we can help with, that our life services can help with. And by the way, when we look at the overall cost of someone that is justice involved versus someone that is not, the costs are 8, 9, 10 times higher. Lots of behavioral health issues, lots of substance use disorders. So these are the folks that really need engagement, really need someone to sort of help weave together different community-based organizations that can help support them as they move forward. I'll give one more example and then we can sort of move on. I was listening to the conversation earlier. We know the governor, and he's got a very high priority around maternal and child health. And we talked a little earlier about some of the challenges that African-American women have. Well, we took the data and our data, and we've got a lot of it, and our data scientists sort of combed through all that. So we know, based on our data and based on just national data, that African-American women have very challenging birth outcomes in general. But again, our data would support the fact that there's a certain BMI and if they are smoking. So if you pile those two elements on top of that, and you look at the data, this is like the health outcomes for a healthy birth are like in the bottom 10%. And so then we took that and we apply that to our current population, because we now have bidirectional feeds and data sharing with many of the different safety net organizations in Indiana, I think uniquely so. And so we have a better view into what's going on. So we're able to take that data and apply that into our current population. We found something quite interesting. About 95% of the cases, and there's some predictive stuff in there and some fancy data usage, I suppose, but we found a very, very high percentage of folks were in Lake and Marion counties. And that then allowed us to deploy feet on the street into people's homes. Obviously, in a post-COVID world, or not post-COVID, but during a COVID world, that becomes even more important to really be able to see, hear, listen on what's going on. So this is a newer program for us. Maybe next year I can come back and I can report what the data is. But we're really excited to be able to use data. And I thought I would share an example to sort of really target our resources where we know we can make a very, very big difference. So life services, justice involved. Oh, and by the way, if you want to hear a story, I love this story. If you go to Google and you type in Sam CareSource, you'll see an amazing story about Sam from Indiana, who was justice involved. And he kind of talks about his experience through our program. And I can never do it justice. So I would encourage you, if you want to type in Sam CareSource and it comes up and you'll see what I'm talking about. Anyhow, this is a super important subject. Applaud everyone for coming together to have this discussion, and am very thankful for the opportunity to be a part of it.
Erhardt, thank you so much. And thanks so much for that perspective. And I know we're going to be hearing from you here again in just a few minutes.